NK Arora is the member of the Entagi group which decides on the immunization program, and this is the group that has made suggestions to the government vis-a-vis increasing the dosing of the Covishield vaccine. Among the other suggestions that you all have made, Dr. Arora, thank you for your time. I want to ask you, world over, AstraZeneca's duration between the two doses is about 12 weeks or so, less than 12 weeks. 12 weeks is considered ideal. What made you come up with the decision to go for the 12-week to 16-week duration?
So, first of all, I would like to uh, emphasize that India and UK are the two major consumers of this vaccine. Practically no other European country is using AstraZeneca or the Covishield. In North America also, it is a very small amount of vaccine is used by Canada. There is some vaccine usage in Latin America and Africa and our neighbors. And there is highly variable interval used by different countries. And the reason is that original initial data was not very convincing whether one should go for 4 weeks, 8 weeks, or 12 weeks, or more than 12 weeks. In fact, the original AstraZeneca data was showing that if it can go up to 44 weeks and beyond 12 weeks, means total of almost 6 months. So we did not go in for a longer interval initially, particularly when we were told that the focus of the vaccination is for 45 years and more, and we have sufficient vaccine. 6 weeks later, we reviewed after WHO came, and we thought that at that time we again reviewed the data, but we made it 6 to 8 weeks because beyond that, the uncertainty of getting the breakthrough infection was very high. And we, in fact, requested that if real life data comes from UK, because that's the biggest user, and if that shows good protective efficacy after first dose of long interval, then it will become confident, because we have a huge population, and if a lot of breakthrough infections occur, it does not augur well for the confidence of the people. So in the last week of April, this evidence came from UK Public Health Agency of England.
Yes.
And then Scotland as well as Bristol. These data came which shows that the vaccine, a single dose vaccine, is 65 to 80% effective.
Yes.
And taking that as a lead, which has come from real life data, and then there is some data from Canada, which is obtained on a personal level. They are giving between 12 weeks and 16 weeks. So keeping all this evidence, the committee decided that we will have a 12 to 16 week interval between two doses of Covishield.
What happens to those people, Dr. Arora, who've taken 2 doses of the vaccine already and are concerned now that perhaps they have to go in for a booster dose of the vaccine? Because they have been saying that we have taken the 2 doses, which doesn't mean that the efficacy then gets reduced because we took it within what the government had initially suggested.
Very valid question. I am sitting in front of you. I had exactly 4-week interval. I was one of the first one to receive on 16th January, first dose, and then got the second dose around 15th or 14th of February. So, and similarly, there are people who have taken at 2-month interval. That means 6 to 8 weeks. In fact, when you complete the schedule, the antibody levels go very high. And as a result, your efficacy is good enough, and you don't need for any booster, at least for the time being. Maybe just like Covaxin has asked for, there may be possibility 6-9 months later, booster may be required for anybody who has received it even at 3 weeks. So there is absolutely no concern. We, as our horizon of people who are receiving vaccine is increasing, we would like the maximum benefit, and that is the reason that committee revisited the whole interval schedule and decided to increase it to 12 to 16 weeks.
You know,
But
Dr. Arora,
just let me complete.
Okay.
So, but simultaneously, to further consolidate our and reinforce our decision and whether we are on the right track or not, what we have done is that a national vaccine tracking platform is being established so that those who are getting infection and those who have vaccinated, we will put the data together to see if there is any increase in breakthrough infections. Because if there is a significant increase in breakthrough infections, we might have to revisit the decision because the vaccines work in different environment, not exactly same as it is. And that's the reason in Sri Lanka, they are using at 10 weeks. There are places where they are using at 8 weeks. I think Nepal is using 8 weeks. So there is a variability because the data does not give you confidence the way it has been done so far.
Okay, so from what I understand, you're saying that this decision to give this dose of the vaccine, the second one, between 12 to 16 weeks also is something that could change in the next few days or weeks or so.
No, not days or weeks, but three to 4 months later, we are going to revisit. This is part of our minutes of the meeting that we are going to revisit this decision and accordingly, because we are going to be the huge on the we are still the largest user of this vaccine, and decisions we take, particularly in poor countries, this vaccine is being used. So we will have to be looking at it based on our own data so that it is a guidance for us as well as many other countries which have similar environment.
Dr. Arora, the argument is that we just didn't know what to do. We all know that there are no doses in the country. There is a major supply crunch. The demand is extremely high. And that's the reason why you just had no option but to take this call.
Yeah, that is repeatedly being said that this is not any technical reason, but more because of to take care of. So I will give you the reason that if we increase the dose by 1 month, only about 4 to 5 crore doses. Today, single dose recipients are about 14 crores. 2 doses recipient are 4 crores. And out of single dose recipients, 14 crores, 10% or about 2 crores are your Covaxin. Remaining 12 crores is Covishield. And if I increase the interval, it is a matter of 5 or 6 crore doses only. Now, if I increase, still those 5-6 crore people will have to be given the vaccine a month later. For a country of our size, how much difference will it make? So it is not just sparing the vaccine strategy. It is a technical reason that we would like our population to be best protected in the current scenario.
But you didn't have that in mind at all? That because I remember so well that when the UK had first introduced AstraZeneca, they did say that we want to cover maximum number of people quickly, and that's the reason why our gap is 12 weeks. You didn't have that in mind at all?
At this time, because it is not, because when they were starting, 3 months means 3 months, and they had a huge amount, and they did it also for Pfizer vaccine, where they were clearly told by the manufacturer that beyond 3 weeks they are not responsible. And they were having raging outbreak at that time. So that time they took this decision because of vaccine insufficiency, and they wanted to vaccinate the largest number possible as soon as possible. So that was you're absolutely correct. This is on December 31st that the PHE came out with that statement. But when we started, we had sufficient vaccine, and it is for more than 45. Even now, if we just focus on 45 plus, we will be able to saturate that population by July and or mid-August. So that is not an issue. The vaccine insufficiency has come up more just last 1 week or 10 days, primarily because 18 to 45 is there. So our target is at
Oh,
the
there were
moment that
problems of the shortage of the dosage, sir, even before that. It's not just that ever since 1st of May, we're talking about shortage of vaccines. There's just been so much back and forth on shortage of vaccines even before that, ever since the drive began pretty much.
no, it ever since drive began, no, it is. I would agree that in the later part of April there was shortages, but we have been given to understand that even now, total 50 or 55 crore doses have been promised for the program to be given by the end of July, which is sufficient to saturate 45 years plus population. So the vaccine shortage is certainly there, but it has been exaggerated by 18 to 45 primarily. The second thing is there are other ways of vaccine sparing strategies. By those who are infected, defer the vaccine for a while. Those who get corona after first dose, defer it for a while. These are truly vaccine sparing effect. And I
Okay.
think a decision is going to come up for that. So that is more effective way because you are addressing a larger population and
Okay.
you spare the vaccine because those who are already immunized in the by infection, natural infection, you spare that. But this one is more to look at and improve the vaccine efficacy so that people benefit from the vaccine.
You know, Dr. Arora, that brings me to my next question, because that again is one of the suggestions that you made, that those people who've got the infection defer the vaccination of the second dose by 6 months or so. You are doing that because you are admitting that there is a shortage and people do have antibodies and that's going to offer them protection up to 6 months. Is that the data that you have with you?
So the exact deferment is yet to be decided. It is not 6 months. It is yet to be decided. But we have the data from India which shows that for a fixed period there is the individuals are totally protected, and all those data is being taken into account when this deferment decision comes through.
What has the government told you as far as those suggestions of deferring this vaccine for up to 6 months, the second dose for up to 6 months is concerned? Or even the
So now
first dose for that matter?
you are bringing up the duration repeatedly. That duration has not been finalized yet. I think in a day or so this will be finalized. But the important point is that vaccine sparing strategy is this vaccine sparing strategy. Whether it is 2 months, 3 months, 4 months, or 6 months, that is a vaccine. So once somebody is infected, somebody has a RT-PCR or RAT test positive infection, you defer the first dose of vaccine, or somebody gets the first dose and then gets the infection, you defer the second dose. These are vaccine sparing of strategies, and it will become very apparent in a day or two.
Which are
In
the
that
others,
way,
sir?
so we will be able to spare the vaccines in that case a sizable amount of vaccine, because the current infection rate is so high that that will help the community very well, and it will not harm those who have got infected because they are protected at least for a certain period.
So which are the other strategies that you've recommended to the government for sparing the vaccines?
That's the only one.
Okay. Sir, you also have suggested lactating pregnant and vaccinating pregnant and lactating women. Just to tell us, where is the data? Because trials, I believe, have not been done on pregnant women at all.
So no decision, a specific decision has been done on that. I think whatever is circulating is not correct. And I think all of us have to wait what the final decision is taken by the committee as well as by the government. I think we'll have to wait for a while.
Okay, so right now, lactating women and pregnant women should not be taking the vaccine.
As of today, lactating women will become eligible for getting the vaccines.
Okay.
For pregnant lady, a firm decision is yet to be taken.
All right. Lactating women were also part of the clinical trials for both the vaccines, sir?
Lactating women, the concern for fetus is not there anymore. And the vaccines available are not live vaccines. So That's why the world over, including WHO, suggests that lactating women should get all the vaccines.
Also, when I say lactating, I mean women who've just had a baby and are feeding the
Yes,
child. So they can
that's
take the
correct.
shot against the
That, so
infection?
immediately after delivery, anytime these women can take a shot.
So via the breast milk, will the immunity be passed on to the child also who's feeding from the mother?
This is very important question and interesting. I think there are very little studies, but as a general principle, whenever mother is immunized, children do get benefit out of that. But here, the type of vaccine, the type of antibody which are required, uh, it is oral antibodies are not there, or whether to what extent that would be, because breast milk excretes vaccine antibodies which are working on the surface of mouth and the gastrointestinal tract. So this issue is not very clear. At least
Okay.
I am not much aware of how useful it is.
All right, Dr. Arora, thank you so much for joining us. Interesting things that you've told us, and you've also indicated that there is a possibility that soon a decision is going to be taken on whether those, in fact, who have recovered from COVID will be taking the vaccine after 6 months or 4 months or 3 months. That again is something that needs to be decided by the government. Your suggestions have been made. Thank you so much for your perspective, sir.
Thank you.
Thank you, sir.